Absolutely.
So I blame less RFK Jr. than I blame Macri and Prasad. Those two are bad people, okay? And the things that they have done, the policy that they've published for all new COVID shots, pretending like we're restricting them only to healthy people. Actually, yeah,
Right.
right.
But it covers everybody with pre-existing conditions, which is
Yeah, it
the
covers
majority.
about 75% of the US population easily.
Right.
And I've written an article about it. This is eugenics. It's avert eugenics. Because if you are they're prescribing this drug that's known to cause pericarditis, myocarditis, and FDA actually admits to it and actually writes a letter to Pfizer about it. At the same time, FDA writes a policy saying that people with cardiovascular conditions should get it first without placebo-controlled studies and without long-term safety monitoring.
Wow. So Makari also, this was a few weeks ago, I saw he was announcing that the FDA was launching a nationwide listening tour. Remember this? And at first I read that, I was like, wow, maybe this is going to be good. And then the next sentence was, we're going to listen to the needs of drug companies and biotech firms, but not the people. So they're not listening to the people. All they want to do is make business easier for vaccines, drugs, and biotech. That's it.
Exactly. They're listening to her. And then he also said in the video that they're creating safe space for pharmas to talk to FDA.
I mean, honestly, this is classic fascism. This is medical fascism because it's the conjoining of big government with big business at the expense of humanity, where government and pharma only see the value of the American people as vessels for profiteering through injections and medications and nothing more.
Absolutely. Yeah, you summed it up perfectly, because this is what they're doing. The FDA and HHS, they treat it as their job to create market for pharmas,
right.
And they're behaving that way. So I'm saying to people, if you don't believe in the depopulation strategies or enforced sterility and so forth, fine. But here we have a very clear example that FDA is working for pharma. They're creating market for pharma, and they're working really hard. And the new policy for COVID shots is not the only thing. They also relaxed the CAR T, so they're no longer requiring long-term safety monitoring for CAR T therapies, which is like these gene therapies that are used in cancer, amongst other things. So they're very dangerous, and they're supposed to have post-market safety monitoring programs, so-called RAMs, risk mitigation strategies, and they just waived them just now.
Of course they did. Who needs science when the FDA is just pushing profiteering? Now,